Hi everyone. So in this educational YouTube channel that we have, we've had a fair bit of people asking to explain things which seems to be resonating with people. So I'm going to continue to do this and correlate that with day-to-day things that I do. So I saw a patient today who had neck issues, essentially. The issue was there was fullness underneath the neck, and this patient wanted to know about liposuction. Okay, and this is an area that I have certain thoughts around. I'm going to want to share with you guys. So why is liposuction done? Is it a good operation for the neck or not? And if so, what is good about it? What is bad about it? So I'm just going to go over in a little bit of a detail what that means. Okay, first and foremost, as I always do, instead of showing gory, bloody pictures, which doesn't appeal to everybody, I'm just going to use some cartoons that I pre-drew here. Okay, if you were to look at a face from the frontal view, so frontal view meaning like this, right? I'm just showing the jaw and I'm showing the neck. So this is the jawline clearly, right? These green lines represent the turkey bands that people have. So if you notice older patients, as we all get older, we get these bands that come down right here. The band is actually the edge, the inner edge of a broad sheet of muscle that's across the entire neck. There's one on the one side, there's another one on the other side. And this muscle is it's like a strip steak. The best way I can think about it is because it just looks just like that. It's like a long strip. It's a very flat muscle, and it kind of goes from top down just like this, and it kind of blends into the chest. And so these green lines represent that. I just ended here, but realistically, it goes a little bit further out towards the side of the neck, kind of like this. Okay? I also drew this on the opposite side, and I put these yellow, or I'm sorry, not yellow, but black circles. These black circles are meant to represent fat cells, fat particles or fat cells, okay? And I put it on top of the green, indicating that these black particles or black cells are fat that's directly below the skin, okay? If you were to look at it on the side view here, this is the skin. The black now is represented by green here, just so that I can have some contrast. This is the same layer that this black represents directly underneath the skin. So these green on the side view, these black on the front view are the same anatomical structures, which is fat cells directly underneath the skin. That's why this view may be a bit more descriptive to show fat directly here. So when you do liposuction, and if this amount of fat is very bulged out and there's a lot of it, all of it is fat like this here, all of this extra fat is here, like I'm depicting with this, you can essentially put a liposuction cannula, right, inside the skin, underneath the skin, and you can evacuate all of this fat or a lot of it out and remove it, right? You can remove it. And that is basically liposuction of the neck. That's what's typically referred to when you talk about liposuction. So you're basically thinning out this layer by removing it with the cannula and essentially putting it in a jar. That's the liposuction or lipocontouring of fat directly underneath the skin. This, when it's done aggressively, could be a big problem for patients downstream, 2 years, 5 years, 10 years down the road. Why is that? Because all skin of the body, everywhere, you need a layer of support structure with fat. That's the reason fat's there also, right? Because it's just not skin and bone. There's fat, there's skin, there's muscle, there's different layers that are necessary to give you the proper structure. Well, if you thin this out way too much to create a very sharp angle, this skin is not going to have any support at all. And further down from surgery, people are going to look terrible because they're going to have these very thin looking, streaky looking skin that just looks horrible. Okay, so when you guys see before and after pictures, on Instagram, on other places, please, see it with some degree of suspicion, because the pictures early on can look great because there's swelling, there's this, there's that, and also clearly, young patients have good elastic skin and they look fine. But the older patients get, those same young people, when they've had aggressive liposuction, it's going to look terrible. Okay, not for everybody, but for a lot of people. And another problem is that that it's not talked about often is, if you notice in this picture here, okay, and also in this picture here, I've drawn some blue circles. This blue is supposed to represent more fat that is behind this muscle here, the green muscle called the platysma, okay? This is behind it. It's not, you can see it's behind all of this fat deep inside the neck. So when people have thick fat necks or thick pudgy, kind of chins or whatever underneath the chin, it's not always just the fat underneath the skin that's the problem. It could also be fat deep in the neck right here in between these muscles. And liposuction will not address that, because you cannot put a cannula there from the skin and suck that fat out. It's deep in the neck. It's just not possible. So you have to address that, and the only way to address that is with surgery. So one good way to do this surgery very methodically, very precisely, and long term and safely is to make a little incision underneath the chin right here. A small incision underneath the chin right here. Okay, it's going to be right here in this area on the side view. From here, you can reduce this fat. Just for color contrast, again, I'm going to draw it with green. You can put a cannula through this little opening here, and under some degree of visualization, you can reduce some of this fat conservatively to leave enough of a buffer. But because you have this opening here, now you can go remove all of this or a lot of this directly under direct visualization as well. So you can go and remove this deeper stuff, very precisely. And when you do that, another thing you can do with this surgery is you could unite these inner edges of this sheet muscle by putting sutures and tightening it up in the center. So when you're all said and done, it's going to look like, the green is all across the center and there's no space, and now there's no fat underneath there. So you get that depth that you're looking for. And this is a much more thorough way to do neck contouring. There's a lot more that we can do beyond this. Nowadays, we can even use a device called J-plasma Renuvion and also put it underneath the skin right after liposuction so that you can get some skin contraction without having to remove any skin. And so it's a 3-tiered process, right? So you do some liposuction under some visualization conservatively. You go and remove the deeper fat compartment conservatively. You do a platysmoplasty, or the tightening of those muscle edges, directly to make it all uniform sheet of muscle across so it looks nice and smooth. And the last thing you do is to also do something called J-plasma, also called Renuvion, which is a radiofrequency plasma energy field that causes skin to contract. When you reduce the bulk, that loose skin just shrinks a bit more. So this is a very thorough way to do neck surgery. And this is all something that can be done also under local anesthesia. To do all of these maneuvers in my hands takes about an hour and a half or so to do awake surgery. The only incision people have is this one little incision underneath the chin, which is not visible after a few weeks. And your patients are awake, you do what you have to do, you put some compression garment afterwards. In about 3-4 weeks, you will see the definite change in the contour of the neck. And in the next couple of days or so, I will post a picture of a before and after of somebody that has that. So I wanted to share this because there's a lot of discussion I've noticed that patients have, because liposuction seems easy, right? Just suck it out. But it's never ever that simple in surgery. If you really want to do serious surgery, you have to be conservative. You have to think long term. You have to think of all of the different compartments of the fat of the neck. You have to think of kind of the muscle and how to tighten it up. And you have to think about skin, what you do with the skin. Do you shrink it with the device? Do you let it contract on its own? So lot of things to consider, just not just going and removing fat. So this is a very timely topic that came up this morning, and I wanted to share this with you. So I hope this is clear enough for patients' understanding. Of course, this is geared for you, not for physicians. Physicians, the talk is very different, but for patients, I want to make sure that it's very simple and clean, yet precise enough that if you do go see a doctor, you can ask and think about all of these various components very thoroughly, okay? Please visit our YouTube site. Please visit my Instagram, and there's a lot of information, educational information that we're posting. Thank you.